Leiomyoma of the uterus, or otherwise uterine fibroids, is a very common condition, and it affects close to 30% of women of reproductive age. Uterine fibroids can be found in young women as early as the age of 13 all the way up to the age of 50 and beyond. It is a fact, and a larger number of black women suffer fibroids. Fibroids are benign tumors of the muscle of the uterus that initiate growth as one cell, and they grow bigger, and their size can range anything between a few millimeters to several centimeters. Fibroids can cause infertility. Although the subject has been very controversial as to which fibroids cause infertility, do all fibroids cause infertility, or there is a specific type of fibroid that causes infertility, the fact is that fibroids cause infertility, especially the ones that change the shape of the uterus, the size of the uterus, and the ones that they grow close to the uterine cavity. Fibroids, when they grow large, they can cause infertility via several mechanisms. One mechanism can be the distortion of the anatomy in the pelvis and the positioning of the ovaries and the tubes, which might compromise the egg pickup mechanism. Another mechanism of causing infertility is the presence of leiomyomata inside the cavity. Whenever a fibroid is located inside the cavity, implantation is practically impossible. Fibroids that are submucous and they extend very close to the endometrium, which is the lining of the uterus, can cause also failure of implantation and infertility, or they can cause early miscarriages. Some fibroids need to be treated, some of them they don't need to be treated. It all depends on the effect that they have on the patient's ability to conceive. Surgical treatment or myomectomy can be accomplished via three different approaches. One is the open surgery, or as we call it, open myomectomy, which is accomplished via laparotomy, opening the abdomen and removing the fibroids. Second approach is via the laparoscope through minimal incisions on the anterior abdominal wall, utilizing the laparoscopic technology to remove the fibroids. This technique, although it is very useful in certain types of fibroids, it cannot be applied in 100% of the cases, and also there have been certain concerns regarding the integrity of the uterus and the ability to carry a pregnancy to term after removal of fibroids laparoscopically. For that reason, each case is considered separately depending on the size, the number, and the location of the fibroid, as well as their access through the laparoscope. When fibroids are submucous or intracavitary, the best approach is the so-called hysteroscopic myomectomy. That approach does not require any incision on the abdomen. The myomectomy is performed transvaginally through the vagina and the cervix using the hysteroscope, which is an instrument that helps us resect the fibroid in small pieces and remove it from the uterus, leaving a small defect on the uterine wall, which heals quite fast in approximately 3 months. Then the patient can attempt pregnancy, and most of the time the pregnancies are very successful. Transvaginal sonography has proven to be an invaluable tool in our hands in the complete evaluation of the uterine fibroids, because it allows us to measure accurately the size of the fibroids, as well as determine their exact location, which will help us determine whether or not those fibroids need to be removed or the patient can conceive with the fibroids in place, and also to determine whether or not those fibroids will pose a risk at a pregnancy in case a pregnancy happens.